Please help me welcome Dr. Anthony Brown.
And good afternoon, and such a pleasure to be here. Thank you for joining us for this important and much needed discussion on the discriminatory impact of COVID-19, the pandemic's role in highlighting entrenched racial inequalities in the US. While COVID-19 can affect anyone, the largest disparities so far have involved race and ethnic groups. America's long history of racially discriminatory political, economic, and social policies create conditions that put African American and Latinx communities at substantially greater risk of contracting and dying from the coronavirus. While a long history of xenophobia rears its ugly head again in the scapegoating and attacks on members of the Asian community. In the case of African Americans, housing segregation and redlining have disproportionately forced Black Americans into communities that have systematically been under-resourced, limiting access to quality schools, food, medical care, jobs, housing, and business ventures. This long-standing pattern of segregation is worsened by environmental racism, which adds another layer of vulnerability, as these communities are likely to be near sites of contamination, landfills, incinerators, and the like, and further away from clean water, air, and soil. This is a form of invisible violence that deprives communities of healthy living environments and is compounded by unequal access to healthcare, substantially intensifying the risk of chronic conditions that compromise immune systems like asthma, hypertension, making the virus that more dangerous. Not surprisingly, recent data from New York City indicates the following. Latinos, who are 29% of the population in New York City, account for 34% of the deaths. African Americans are 22% of the population and 28% of the deaths. Whites are 32% of New York City's population, accounting for 27%. And Asian Americans are 14% of the population and 7% of the deaths. So joining us this afternoon to explore this topic is an expert group of panelists. Professor Anaï Valdridge is Professor of Sociology and Anthropology at Queens College. Professor Vivian Louie is a Professor of Urban Policy and Planning and Director of the Asian American Studies program at Hunter College. Professor Lazaro Lima is a Professor of Latino Studies at Hunter College. And last and certainly not least, Professor Roseanne Flores is a Professor of Psychology also at Hunter College. As we begin, I want to direct a question to each of the panelists, which is, tell us briefly about yourself and why is this topic important? Professor Valdridge, I'll start with you.
Thank you very much, Anthony, Jessica, and all the panelists. I'm happy to be here. Personally, I'm an immigrant. I know by a fact many of the issues that immigrants are dealing with in New York City and the United States at large. And I've been working on health disparities and health inequality for almost 20 years now. This topic is personally and professionally very important to me, and I'm happy to share what I know and what I've been learning for the past few weeks about this pandemic.
Okay. Professor Lima.
So I wanted to thank all the organizers for making it possible to have this rich panel emerge at a moment that's so propitious and absolutely necessary. And certainly the leadership at Roosevelt House has been exceptional, and I thank all the staff and faculty there. I want to just basically share with you that I'm a scholar of Latino studies, which basically means that I study the largest minority group in the United States. Latinos comprise approximately 59.5 million of the US population, yet we are the most disenfranchised from American cultural institutions and circuits of power. So when we think through those issues related to COVID-19, we have to consider the obvious effects of class standing and how that matters with various constituencies and communities. And, you know, Anthony, when you started your conversation, you talked about the Hispanic population of New York City, you know, in our boroughs. That's approximately 29% of the population, and then they account for 34% of the deaths. So we're entering into a political moment of what Miguel Diaz Barriga and myself and various other scholars of Latino studies have called of necrology. That is where the deaths of those servant communities and those communities that are seen as expendable commodities under capital really need to be thought through so that we can get a better understanding of how to understand the democratic commons. So I appreciate the invitation, and I'm happy to share information that I've collated and researched with my students at Hunter College.
Professor Louis.
Thank you
Yes.
so much,
Yeah.
Dr. Brown, and thank you so much to you and to Dr. Neuwirth for inviting me to be on this wonderful panel with such esteemed panelists. I also am so excited that Hunter's Roosevelt House, which of course does incredible work, has brought us together in this exciting conversation. So like my esteemed panelists have just shared, I mean, I've spent most of my professional and civic career focusing on what we can do to change social inequalities, to reduce them. I've written and presented on what immigration, identities, education, socioeconomic mobility, what that all looks like for immigrants and the children of immigrants in the United States, including in New York City, and how success happens. I'm fortunate to be at Hunter. This is a terrific community that values, that supports, and transmits this kind of work. Asian American Studies at Hunter. This is a terrific community with an undergraduate program that has outstanding faculty and students, a center's public programming, as well as exciting faculty research done across Hunter's many academic units. But I want to say that Asian American Studies really starts from the place that I think anchors this discussion, which is that to have a discussion of America, you need to have a discussion of all its peoples. And that to move America forward, we need to work together. And so that's how I would frame today's discussion. Thank you.
Thank you. Professor Flores.
So I want to thank Jessica and Anthony for putting this panel together, and all of my fellow panelists. It's a pleasure to be here with you at Roosevelt House, even though virtually. So I am a psychologist. I'm a developmental psychologist, but I'm also a human rights scholar. And so I'm coming to this from both perspectives, from the psychological aspect, but also from the human rights perspective. And I study educational and health disparities, and I've been doing so for a while, within African American and Latino communities, because my own identity is a mixed identity. And so I not only is this something that I do for scholarship, but it is also something that's personal to me again as well. But one of the reasons that I'm really passionate today or thinking about this topic was I also had the opportunity over the past year to work up in East Harlem as a technical advisor with the community up there, and addressing health and well-being for that community, particularly families and children. So we spent a lot of time with the New York Academy of Medicine listening to the community about what their hopes and dreams were for their families, what the things that they thought that they didn't have access to. And this was right before this pandemic hit. And I remember the community just being at a meeting with them and the parents and the families sitting there saying, you know, we really want mental health resources for our kids. We really think this is important. This is something that's very much on the forefront of the minds of all of these parents. And again, it is not because they don't want them, it is because they don't know where to go to have access to them. And so that a lot of the conversations stemmed from a mismatch from what was actually in the community, because by the way, Mount Sinai is there, and there are resources in the community, but families didn't know where to go to get them. And moreover, even if they did, they didn't think that they would be welcome there. And also they heard from people in the community, you know, if you don't speak English, we're not gonna be able to help you, right? And so all of those things are, I think, what we're here to talk about today, which has sort of led up to the present time in this pandemic. The lack of access, the lack of not knowing what's available, and also just being disenfranchised. And so again, this is something that I was working on all year long. This pandemic hit, and now it's sort of right there in the middle of East Harlem. It's right there. These are people who don't have access to a lot of these resources. And again, as was said, this topic is not new. It's been something that we've been dealing with for a very long time. And I hope at the end, and I know we're going to talk about that, we'll come up with some concrete ways of dealing with this. On the human rights side, though, I do want to say that this is a global issue. We're talking about it locally, but this is also a very global issue. And in order to address this issue going forward, we're really going to have to talk about that in terms of human rights. This is one way to think about who has a right to life, if you will, and whose life is more valuable than someone else's life. Who has a right to access to healthcare, and I'm not even going to say healthcare, but high quality healthcare, because people have access to healthcare in their communities, but what kind of healthcare do they have access to? And then finally, it's going to get to the place of movement and a right to be able to move. And who will have a right to travel? Right now, we're sitting here, but we all know that we have family members who are not physically here in this country. And will they be able to travel back once this is over? Some countries may be able to, others may not. So I sort of going to end there, but that's how I come to this panel today. So thank you.
Great. Thank you, Professor Flores. I want to circle back to Professor Villodrich and ask her a few questions. One is, how has COVID-19 exposed the health disparities experienced by racial and ethnic minoritized groups in New York City? And what are some of the most striking social and economic consequences amongst these vulnerable populations?
Thank you very much, Anthony. And my colleagues have done already a great job summarizing some of the topics that relate to this new attention to health disparities. There are a few things I want to mention that may also help the discussion. One is the topic of structural vulnerability that is a term that we use to address the fact that these minority populations, immigrants, particularly undocumented immigrants, are exposed to conditions that lead them to be more exposed and die at higher rates than white populations in the United States. That's why we have these figures that actually surprised de Blasio and Cuomo. We never heard them talking about health disparities until they got these figures, 34% of fatality rate in New York City being represented by Latinos. And the other issue I wanted to mention is also the microaggressions that minorities are exposed to when trying to get health services. Even though they may have access to health services, they are being sent back, they are not given the right information, they don't have access to information in their language. So we tend not to look at the microaggression part of the equation, and I think it's very important. And finally, I wanna refer to one of the dimensions that we use when we talk generally about health disparities, and it's the well-known chilling effect, which is actually a legal term that has been popularized as a way to understand when people have access to benefits, but they don't use them, or maybe fearful. Let me tell you what's going on today with the undocumented immigrants I'm dealing with. They are fearful. They are fearful in terms of becoming a public charge. We hear that the federal government and the state of New York is stressing the fact that you don't have to be fearful of becoming a public charge if you access COVID-related benefits. The truth is that we don't know what's going to happen with this federal government. They don't know if at some point those services and benefits may be actually turned against them. So our role as scholars, as advocates, as public health advocates, we need to inform our communities of what they are entitled to. The second main fear is the fear of disclosing personal and legal information that may lead to deportation. On the one hand, we have the state government talking about New York City being a sanctuary city. On the other hand, we have ICE deporting our neighbors, right? So the fear of deportation is here to stay. We need to work with immigrant organizations to really provide what our minority groups need in order to protect themselves. And the third, the last but not least fear is the fear of health costs. We live in a country where we have the highest, the most expensive expenditure model, health model in the world. People going to the emergency room or may even accessing Medicaid, emergency Medicaid, they're still fearful that at the end of the day, there are secret, hidden costs that will come to them and they won't be able to afford them. And let me tell you, this doesn't apply only to undocumented immigrants or immigrants for that matter. It applies to all of us to a certain extent. Again, we live in a country where access to healthcare and medical insurance is a commodity, it's not a right. So piggybacking on what my other colleagues have suggested, we have to address this issue as a human rights issue. The issue of accessing healthcare and having the right to be treated without the fear of being punished and deported. Thank you.
Well, thank you so much for that. A lot to think about. I want to bring Professor Louie into the discussion. Talk about what are the mortality rates, rather, for Asian Americans, and why is this the case? And in addition to that, another discriminatory layer of the virus that we've seen, Asian Americans are having to confront anti-Asian bias and hate crimes. Help us understand what's going on here.
Thanks so much, Anthony. I mean, those are two important questions, and I thank you for raising them. So I wanted to start off by saying that there is, at the national level, just to echo what you already shared, Anthony, that there is an underage in terms of mortality rates for Asian Americans. What we know from the states that have available data and from Washington, D.C., we know that Asian Americans are about 5% of the total COVID deaths reported so far by race and ethnicity. And they're about 5.6% of the nation's population. So it's an underage, right? But as we all know, this is a picture in flux. The car is still moving. So we need to kind of keep that in mind. But there are 2 points that I do want us to consider, even with that said. And the first is that states vary in how they report this racial data and ethnic data. So there isn't a lot of comparability, or at least that's an issue to keep in mind. And second, states do not typically report disaggregated data for Asian Americans. And this is unfortunate because this is the very group for which disaggregated data is critical. Because the whole category includes groups, 20+ groups. And there's such incredible diversity in terms of educational levels, income, and language. And you mentioned earlier, Anthony, about the underage, but I'll repeat it, right? They're about 7% or 7.9% of the total COVID-19 deaths, Asians in New York City. And that's about half of their overall population. They're 15% of the city's population. So I guess the question is, why is this the case? And this is a big question, right? And it's a puzzle. And I wanted to start off with that puzzle by saying that 1/4 of Asian New Yorkers are poor, right? 1/4 of low-income and poor Asian New Yorkers do not have health insurance. Low-income and poor Asian New Yorkers also live in densely populated neighborhoods and in multi-generational households. So these are homes with a lot of people. About 1/4 of Asian American senior citizens in New York City are living in poverty. And while we don't, or I don't have the exact figures for undocumented Asians in New York City, we know nationally 1 out of every 7 Asian immigrants in the United States is undocumented. So why is that all important? Well, because as we just heard from Anna, you know, these are all factors, right? Being poor, not having health insurance, living in densely populated neighborhoods and homes, not having documentation status, being elderly and being poor, these are all factors that are linked to contracting the virus and to getting sick and to dying. So I don't have an explanation for you right now because, of course, the train is still moving, but I have some hunches at this point that I can share. But I should say that these hunches need to be examined systematically with research and through having Asian Americans in the data sets. And and through disaggregating the data. So in New York City, the hunches are that they knew firsthand, Asian Americans, that COVID-19 was serious. They had family in Asia telling them about it. 3 out of 4 Asian New Yorkers are immigrants. They had masks or were sent masks, and they were using them earlier. They were consulting Asian American media that was telling them that this was serious and it was going to happen here. Their social networks were telling them that. And then also folks who were working in New York City's Chinatown and other Asian ethnic neighborhoods were already socially distanced, starting as early as January. And this was involuntarily because people weren't coming to their shops, to their restaurants, and to their businesses. And this was 2 months before it was happening anywhere else. And this was because of the incorrect linking of the virus to people of Chinese descent. So do you want me to talk about the second piece, or shall we hear from more folks? What do you want to do?
Let's hear about the violence, because certainly this is quite disturbing, the pattern of violence, some of the utterances by our leader. So let me hear your take on that.
Okay, all right, sure, thanks. Yeah, so the responses to COVID-19 have unfortunately revealed deep-seated racism and anti-immigration sentiments. And xenophobia towards Asians and Asian Americans. And this is true across the globe, but I'm charged with speaking about the United States and New York City. So we know that to date, 1,600 hate crimes have been reported against Asian Americans in recent months. At its height, there were about 100 incidents reported every day. Now remember, this is when we're all staying at home, or so many of us are staying at home, okay? The New York City Commission on Human Rights recently launched a COVID-19 response team to handle reports of bias and discrimination, and they had their first virtual town hall yesterday. And certainly there are accounts of online bullying, we know that, but there are also in-person encounters. People are getting called racial and ethnic slurs. They're being harassed verbally. They're being told that they're the face of the disease, that they brought the disease here. They're being told to go back to China. At the highest level, they're being physically assaulted and attacked, you know, kind of doing everyday things when they're outside, right? And we have to understand that this is an additional layer of experiencing COVID-19, because of course, Asian Americans, you know, are experiencing what all Americans are experiencing, right? The helplessness, the sense of, you know, the tragedies that are going on. So as to why this is happening, you know, this type of blaming, unfortunately, is pretty reminiscent of how disease has been connected to immigrants in the United States historically. That's the first point. So going as far back as the 1800s and 1900s, you know, German immigrants were associated with yellow fever, Irish immigrants with cholera, Jews with typhoid fever, Mexicans with typhus. As recently as the 1980s, I can still remember that time, Haitian Americans were associated with HIV. And you know, these sentiments, anti-immigrant sentiments, they have real consequences because they lead to actual actions and policies of scapegoating, of blaming, right? I mean, so you see, for example, that Japanese Americans and Japanese aliens who were ineligible for citizenship during World War II, they were interned. Muslims in America and South Asian Americans who were mistaken for being Muslims, they were basically targeted after 9/11 and in the wake of the 2017 travel ban, right? We see anti-Semitism that is still out there and unfortunately still very strong. We don't have to look far to see that. And I think the second is the blaming of China that we have to be concerned about. When I say that, I want to, you know, to reassure us that we should accord responsibility to nations where the responsibility lies. The facts have to come out where they come out. Okay, so that's the first thing. But we have to realize that the blame on China might also cause people in America to blame Asian nationals in the United States, to blame people of Chinese descent, to blame people who might look like they're of Chinese descent, to blame all these groups of people for COVID-19 and for the havoc that it's wreaked on America. And that's important. We've seen from the historical record that that's happened with Asian Americans like Vincent Chen, who was beaten to death in 1982 by laid-off white auto workers who basically were angry that they lost their jobs in the automobile industry, and they blamed Japanese companies and the nation of Japan. And they took him, Vincent Chen, as a proxy for that.
I certainly remember that vividly. That's a good segue, so we could bring in now Professor Lima. So if you can talk about some of the major challenges, if you will, affecting Latinos locally during the pandemic, and how do these challenges play out, if you will, on a national level?
It's interesting. Some of the numbers that were initially coming out with regard to those communities who were at the receiving end of the disparate impact of COVID-19 nationally were fundamentally African Americans, and for reasons that we understand that have to do with comorbidity. So, for example, underlying disease, lack of access to healthcare, diabetes, etc. And those issues were exacerbated by the fact that so many states really didn't even engage with questions about the Affordable Care Act or support systems that would have enabled us to better sort of fortify the conditions under which African American communities would have access to healthcare. When you add the Latino element, and again, I want to stress, Latinos are people of Latin American ancestry in the United States, we have fundamentally an historical lacunae that can't account for why this large population is somehow seen as recent interlopers onto the national fold. So one of the things to think through is understanding and communicating to our communities and to the culture at large, and frankly, with regard to us as educators, to think how to decolonize the curriculum in ways that represent Latinos, not as a recent intrusion onto the national fold, but as a constitutive community to American cultural identity. So when we think through, for example, states like California, Nevada, Nuevo Mexico, Texas, parts of Wyoming and Colorado, these were all states that were formerly Mexico. So the historical amnesia that surrounds Latinos writ large condition our current understanding on the ground of what it means to be a Latino in the United States. So if we go through some figures, we begin to understand that, for example, Pew numbers tell us that of this 59.5 million population, what political scientists call sleeping giants, approximately 60% of them are documented. And this could range from being citizens to having H-1 visas, to being here on separate work permits. So we begin to see disparities emerge along class lines. So you have communities of Latinos, think of South Florida, not as recent arrivals, but as Cuban Americans, who are more identifying with protected class types of workers and white collar workers that can actually work from home. This is not the case in New York City. So the numbers, Anthony, that you cited earlier about the morbidity rate of Latinos is significant because we have a younger Latino community here. And if we begin to disaggregate the numbers of those Latinos between the ages of 18 and 49, we see them as the most susceptible to COVID-19. And some of my colleagues have already spoken to the reasons why this is so. And that has to do with the fact that we have a national doublespeak. That is, at the local level, we say that we have access to healthcare irrespective of your documented or undocumented status, but the practice on the ground in these communities, and I'm thinking of Corona, I'm thinking of Elmhurst, I'm thinking of the Bronx, is that when you have ICE raids targeting these communities, that the relationship to the state becomes such that it is untrustful. So what happens is this idea of access that's being promulgated at the level of local government bears no relationship to the reality that Latinos are living on a day-to-day basis, where, for example, we now have, and this happened a few days ago, and many of us are probably familiar with this, the president invoking the Defense Production Act that has ordered meatpacking plants to stay open no matter at what cost. Well, we had about 6 months ago, ICE agents raiding meatpacking plants in Iowa, Illinois, and Virginia. And who are they targeting? They're targeting undocumented workers who are bearing the brunt of the local economy before COVID-19. But after the fact, we have what is seen as a vulnerable population that is central to the development of local economies and the national economy, yet they're denigrated at a national scale with a xenophobic, frankly, president who cannot distinguish between different Latino communities. And what we need to understand then is, how do we make this invisible constituency, this for political scientists, sleeping giant of 59.5 million, visible to the broader body politic, so they're not seen as recent interlopers onto the national fold, but rather as a constitutive element of American cultural identity. From that, we can begin to then tackle the problem at hand that really cuts to the core of what we have, which is, for example, the stocks of very large companies like Amazon, Walmart, Procter & Gamble, and Microsoft are, in this current economy, faring far better than the market as a whole. And part of the reason for that is that they could sustain the assault of COVID-19 on various local sectors. But what happens when those deliveries, say from Amazon, can't be carried out because you have that swath of the population, those 18 to 49-year-olds, that are sometimes undocumented and subcontracted, unable to do deliveries. So all of a sudden, this invisible community has become visible in ways that were not possible before. So we need to think through what some of our legacies have bequeathed to us with regard to Latinos in the United States. One, the mistaken assumption that they are but recent interlopers onto the national fold. Two, that all Latinos can be grouped under one amalgamatory sort of umbrella term. And what we need to understand is that in New York, we see a younger population of undocumented Latinos bearing the brunt of COVID-19 in ways that other parts of the nation are not. And that should alert us to how we could take leadership roles at public institutions such as CUNY to enable us to, one, decolonize the curriculum so that we can create leadership where it's most needed. This young, vibrant population of students who are going to be faced with the legacies of our ignorance, our national ignorance with regard to Latinos in the United States. So when we begin to think through some of the challenges at hand, we need to think of how we can work in tandem with educational institutions, public programming, and getting the word out that what we have at stake is nothing less than protecting the democratic commons from our own ignorance with regards to Latino populations, not to mention African-American communities.
Thank you so much, Dr. Lima. I want to bring in Professor Flores, because one of the areas that I would argue has not gotten the attention it certainly warrants, if you will, is a discussion about the kinds of trauma being experienced, particularly by communities of color at this time. And also, I want you to talk about how can we help these vulnerable communities and what role, if you will, does human rights play in terms of how we frame, how we address this emotional issue of trauma.
So sure. So again, I want to start off, because we've been talking about this a little bit, to say first and foremost that we need to think about intersectionalities of identity, right? And this is something that we've just mentioned. Dr. Lima just mentioned this in terms of Latinos not being a homogeneous group, if you will, but I would argue people of color, right? So we have vulnerabilities even within groups of people of color. A couple of them are, you might be a person with disabilities, and we haven't been addressing that issue. But in fact, that's been pretty traumatizing for people who have disabilities, who might also come down with COVID, who might be living in a household with family members. So that's important. Age has been critical here, right? Again, you could be a Latino woman who's an older woman, or an African-American woman who's an older woman, who's also the head of your family. And I'm going to talk about that in terms of grief and trauma in a second, right? You could also be somebody who, again, is a person who is experiencing or living with somebody who is in the prison system. And I'm going to talk a little bit about that today again as well as part of the trauma that people are facing, because those tend to be the forgotten groups of the population, but there's a lot of trauma around there right now going on. So some of the things that we know is grief. And we've all been talking about it. Each panelist right today has sort of been focusing on the losses that people have experiences. And those losses are, you know, they're very large losses for people. Whether they are for the loss of life, right? And that loss of life might have been that matriarch in your family, or the person who had the job who wasn't allowing you to live in the home that you were living in, or your mother, or your father, or your sibling. Because again, because of those comorbidities that we were just talking about, you could have lost somebody who was 30 years of age, who might have been a teacher, who might have also been somebody who was critical to your family life. That's very traumatic. It is also, again, we're seeing the same thing for the immigrant population again as well, right? Because there are multiple levels of trauma then, right? You have the trauma and fear, as it was alluded to before, of not knowing whether or not I give information about myself. Is that going to affect me? And if it doesn't affect me, is it going to affect my grandmother? And if it doesn't affect my grandmother, is it going to affect somebody else? So I'm not going to do that. And all of that is stressful. All of those are stressful. And we know from the science, those are toxic stressors. They're multiple risk factors, and they have wear and tear on the body over time. So if you don't necessarily die from COVID right now, you might have a heart attack, right? And I think that that's something that people need to be mindful of, because those are those additional traumas that people are facing, right? We're focusing on COVID because that's what's going on, but that hasn't taken away from those other comorbidities that people have continued to have, right? And again, some people actually are dying from those things, right? They're having heart attacks, they have cancer now, higher levels of cancer. And I think those are things we need to come back to at some point in time to look at after we talk about COVID. What effect has the stress had on the well-being, the overall well-being for individuals? And so that's where I start with the first level of trauma, that and the grief around all of that, and not being able to recognize that grief, not having a minute to breathe, to say, okay, you know what, my grandmother just died, and what am I going to do with that? You don't have time. You don't have time. So you need to move on to the next factor, because then the next factor of trauma is the loss of work and the loss of jobs. Many of these folks are essential workers, right? So they're essential workers, as we've just been talking about. They're on the forefront. We know many of them. Some of them are in our own community. Some of them are at our college. Those are the people who are on the forefront, whether they're the childcare worker, whether they're the person who is packing the grocery store, whatever it is. And so they're leaving their homes every single day to take care of someone else's need, not knowing whether or not they themselves are going to be affected. So that's affecting their well-being. When they get home, they still, if they have children, have to make sure that their children's schoolwork got done. So that was an additional stressor that's put there. And then they have to get up, and some of them have 2 jobs, so they don't have just one. And then they have to figure out how to go from there. And they're not making tons of money, so they're all minimum wage workers. So I can't afford to lose my job. And again, we may say, you know, the laws in New York have sort of said, yes, you will put a hold on evicting people at this point in time, but we know that that's going to pass. So that's also a stressor on the backs of many of these people, and it's traumatic. It's, again, another risk factor put on top of that. And then we can talk about food, another traumatic experience around lack of access to food. And then we can talk about those who are part of DACA. And we know that the package that came through said, okay, and if you have mixed identities, you also were not available to get that $1,200 stimulus, right? So that you can't have access to food stamps. You don't want to apply for that because that puts you at risk. You don't have access to finances, so that puts you at risk, yet another stressor, right? And so more trauma to be experienced there. So now we have grief, we can't manage that. We have lack of access to jobs, we can't manage that. We have lack of access to foods, we can't manage that. And some people have been on the borderline of becoming homeless, right? And so now if they're on the borderline of becoming homeless, now they're actually without shelter and without home. And if they have to double up with other family members, well, okay, those non-pharmaceutical protections that we have told everyone to be able to do, they can't do. That's very traumatic. It's very nice. We're all doing this panel today, and we're fortunate I'm privileged to be able to do so. Not everybody can socially distance in their homes. So they can't socially distance in their homes. Someone must go out to shop. Someone must come back. Someone must come back. And if they do come back, they may have the disease. What do you do with that? And if you ask people again to socially, to do all of the things that we're telling to do to protect themselves, that's more trauma that's been added into that. And so people have died, and we know that, right? Because they couldn't put into place those protections, those public health protections that are important, and we need to do them, but they're not practical for people who are living under circumstances where that's not possible. So that again is more trauma added to that aspect. Then again, I want to talk about the fact that, again, I mentioned violence, and I've mentioned this before, and we haven't focused on violence, right? Think about all those stressors I just mentioned, and now you're living in a household with 4 or 5 other people, and you're coming home and you're tired, and your children have to have their schoolwork done. And so there's a high level, and we know there's been a high, more incidents of violence have been reported, not only just for the adults, but also for children, right? So then we have to get social workers involved to talk about protections for children again as well. And New York City is doing that. Yet another stressor, another risk factor that's been added into the population, right? And then finally, but not least, we need to talk about the prison population, okay? We have advocated for the release of prisoners. Had that been done earlier on, this might not be the problem that it is now, but it is a problem now because they are in confined quarters and they have the disease. So they're coming home or being asked to, they're being released, and where do they go, right? Well, if they come home, then they're bringing the disease with them to come home. If they don't come home, then they become homeless. And they are problematic for their family members who then worry about them, right? I want to take you in, but I can't take you in because you can't live with me because maybe the housing place that I live in says you cannot come here, right? And so you can't be there. So that's yet another stressor that's been added into the mix. And so all of those things taken together, right, are traumatic. And I want you to think, if for all of us and for everyone listening, if we experience one risk, it's traumatic. Add all of those things together and deal with that on a day-to-day basis, right? And then figure out how we move forward. Because the final thing I want to talk about, and one of the strategies that we always say for people to do, is you need to take care of yourself. You need to have self-care, right? We always use the adage of, well, you know, if you're on an airplane, make sure you put your mask on first because you can't help others. In this case, this group of people can't practice self-care, right? They're not going to be able to do yoga exercises. They're not necessarily going to be able to get up and walk around in their communities and go for walks because maybe their communities are not safe and allow them to do that. So that's just yet again another stressor. Yes, it's important to do, but for the families that we're talking about and the communities that we're talking about, they actually don't have access to those kinds of interventions. And I think that's something that we need going forward, need to be very mindful of when we're thinking about these communities. And again, from the public health side, those things make sense, right? We don't have a vaccine, we need to do these things. But really being mindful of how we're asking people to practice them. Maybe one of the factors around that would have been to say, give everyone a mask who are living in homes that they can't necessarily socially distance from, so that when they go out shopping, they would have access to masks. But we didn't do that, right? So because we didn't do that, again, those pose more risk for those communities. Now, from a human rights perspective, all of these things, as I mentioned to you before, have an impact on people's rights to begin with, civil and political rights to begin with, right? So, okay, if we in our society talked about a human right to housing, then this wouldn't be an issue because people wouldn't be worried about that. They would have access. If we had healthcare as a human rights, right, and high quality, again, I keep saying that because we'll get to that place where we'll say, yes, people will have access to healthcare, but it's really important to say what kind of healthcare they have access to, right? Because it's not enough to just say, yes, you can, maybe go to the hospital, but when you get there, you can't get a ventilator because of where you're going. So that's not going to help anybody either. Or a right to food, right? Think about that, just a right to food. And then if you think about it from a child's rights perspective, just the rights for social protections for children who are living in families and communities, and why this is important. So again, as I mentioned at the beginning when I started, I think all of these things that I've mentioned as traumatic as mental health components, as well as physical health components, need to all be looked at through the lens of human rights. And as we go forward, whether we're talking about it locally and or globally and or both, we really need to pay attention to that framework, because the argument is you're not going to make much progress unless you move forward through that lens, because the public health issue is connected to the economic issue, right? Which is also connected to the security issue. And we haven't talked about that, by the way, as a whole, right? So I mentioned prisoners, but that's also security. So that's a local issue, but it's a huge security issue for us right now. And movement, around movement, you know, so we need to pay attention to all aspects. And I think going forward, just really just take a whole approach, because I know what's going to happen. It's going to be easier to say, yes, focus on this one thing or focus on this one thing. And I think going forward, we need to focus on all things so that we come back with a comprehensive package. So.
Wow, thank you, Professor Flores. That really also leads us into the next segment of our discussion. And Professor Flores and others have mentioned some of these, but I wanted to talk more concretely. What should we as individuals, as well as a society, do to confront the issues surrounding this crisis, the issues that this crisis has laid bare? So anyone can jump in. Go ahead, Professor Louis, go ahead.
Always remembering to unmute.
Yes, oh, okay.
First of all, I want to say that it's an amazing pleasure to listen to all of you. And I will say that the first thing that we need to do is to make this new normal into a new way to reach out to our colleagues, our students, our friends across the world. I mean, this new normal that we are creating through virtual media is a channel to create new ways to think about the COVID after, the day after COVID, right? So to make a long story short, I will say that always I see things in levels. The macro level is this disease has humbled all of us, and I hope it humbled also our, presidents and governors, in the sense that we realized how vulnerable we are to a virus that nobody knew. But the other thing is that it makes us realize that we in New York City, and I'm saying this because I'm a global citizen, I'm Argentinian, Spaniard, Italian, I see how across the world, the world has been responding to the epidemics, and we are at the center of the epidemics. We have an opportunity in many ways because the whole world is looking at us. We may not realize in this because we are in the center of it. So we have an opportunity here to send a message in terms of how New Yorkers, how immigrants, how minorities, how our college presidents, how our chancellors are really embracing the situation as an opportunity to make a difference, to embrace our undocumented students. As you know, DACA students in your city is 150,000 people. We here in the CUNY, we have the largest DACA population in the metropolitan area. So we can send a message in terms of inclusiveness, in terms of embracing health rights, worker rights, student rights, faculty rights. We know what's going to happen across the US. We're seeing a faculty being fired. We're seeing our rights as permanent workers, right, being damaged and attacked all the time. So I think that my role as an immigrant, as a woman of color, as a faculty member, is send the message that I'm here to fight for the rights of all of those who I represent here in New York City. Thank you.
Thank you for that. Professor Louis.
Great, thanks. That was just wonderful.
Mm-hmm.
Yeah, I mean, I want to say I have a few recommendations. I mean, certainly to echo what everyone else has said so far, there's a lot of work to do. I'm confident that we can do it. I mean, but it will be, it is a lot. So I want to say that if you've been the victim of a bias incident or a hate crime, you should report it. You will not be asked about your documentation status if that's a concern. We know that that's hard, but we're going to share with you some resources after the session is over about that might help you. I'm going to echo what Dr. Lima has expressed about the need for our educational system to focus on bringing to bear these inequalities, making them more visible, breaking down stereotypes, but also providing us ways to move forward and to share those in K through 12 education, well, PK through 12 actually, higher education, but in out of school learning. So two of the things that I wanted to give a shout out is one is to a youth serving organization, Youth Communication. They publish youth publications. They're based in New York City. It's nationally recognized, but they have a special edition called Inside Voices, Teens Report on Their Lives related to COVID-19, right? So it's about how New York City teens are experiencing this pandemic through being in foster care, being homeless, being sick, losing family members themselves. There's an upcoming great documentary on PBS on Asian Americans. We should watch it. We should learn from these stories, right? We need to tell more of these stories through panels like this, through opinion pieces, through research, through the inclusion of Asian Americans in large-scale data sets. I want to say that, give another shout out to the Asian American Federation, which produced a lot of these descriptive population reports from which I drew in my remarks today. Asian Americans should be in those large-scale data sets. The data should be disaggregated. Latinos should be and disaggregated. There should be better ways of measuring documentation status in those data sets. We need to engage folks at all levels of our government, and we need to engage with the nonprofits that do the important work on the ground level. I know on May 6th, there's going to be another terrific Roosevelt House Zoom session about community nonprofits doing good work. And I also want to say that, I just want to be honest here. Some people still do not believe that this kind of racial, ethnic, immigrant targeting exists, that these social inequalities, that these racial and ethnic inequalities exist, or they don't think that something should be done about them. And this extends as well to Asian Americans, and we need to change that. And we need to have, again, better research. Asian Americans shouldn't be thought as the carriers of this virus, nor should they be thought as having some magic inoculation against it. I realized after I spoke earlier that maybe people would leave with that picture. Don't leave with that picture. That's not what I'm saying, okay? We'll have to look at what Dr. Flores says, the intersectionality of identity, what Dr. Brown has said, right? About environmental racism and residential segregation. Perhaps those are mechanisms that are not as play as much for the Asian American population. We don't know unless we're in data and that, high quality research is conducted.
Thank you. Professor Lima.
Yeah, and I appreciate that. And I appreciate Dr. Louis' really just very thoughtful and engaging macro level discussion of what this all means to us at this particular moment. And one of the things that I do want to stress is we're at a moment of triage right now where we need to figure out how to work locally to enfranchise our communities and get them the type of access to information that's necessary. So I'd like to stress, in closing at least three factors. One, access to accurate healthcare information. The second is how to understand legal barriers in ways that are meaningful locally, irrespective of what one understands in terms of the national discussion about questions of migration or undocumented status. And third, which is central to these most vulnerable communities, is the question of income. And Dr. Louis spoke and Dr. Flores spoke about what happens when you have mixed households, that is, households of documented and undocumented individuals, and how that automatically precludes them from receiving CARES Act funding and the stimulus package. So we're creating, and I want us all to understand this, we're creating a tiered access to what counts as the human, and what counts as being able to exist in the world meaningfully. And those who are bearing the brunt of all of this are fundamentally the ones who make the day-to-day living possible. I can tell you stories about my own students who work at supermarkets and who don't have access to a Mac, certainly not at the beginning of this pandemic. I could tell you about students who are now taking care of siblings because they're home and they don't have access to adequate technology to make this happen. So we need to figure out how to triage as best we can and how to create an ethic of the care of the self, that is communing with others in ways that are meaningful, understanding how, if we are bilingual, how we can access and communicate healthcare information. And some of the resources that are going to be shared with those who are listening with us today are going to include bilingual information and trilingual information that also brings in Cantonese and not just Spanish and Mandarin and so forth. Legal barriers. We need to figure out how we can have interpreters at points of contact at hospitals so that we don't wait until the very last minute where there's the most vulnerable population. The youngest among the most vulnerable, 18 to 49, are the ones who are dying at greater speeds. It's unconscionable that we don't yet understand how to make access to information that is both accurate in terms of healthcare, but also legally accurate. So we need to actually tell institutions and hospitals, think of Norwell, think of all those major corporations that are now organizing healthcare in the United States and certainly in the boroughs here in New York City, that they need to provide adequate translation information for those communities that need it, whether it's Mandarin, Cantonese, whether it's Spanish, or what have you. These are the most vulnerable populations that need to be able to communicate that to their own communities. The question of income. What happens when the most vulnerable amongst us are the ones who are doing delivery of food? What happens when the most vulnerable amongst us are the ones who are caretaking for our elderly parents when those segments of the population could actually go to Long Island in their second homes and run away from the city? So much of this reminds me of the Decameron, Boccaccio's Decameron, where we're in a moment right now where the most privileged amongst us can actually escape the realities of the quotidian and the day-to-day. And what are the responsibilities that are here to us as educators to be able to focus on access to adequate healthcare information, how to really understand legal barriers and the question of undocumented status, and really how to redress income questions, not only in mixed households where you have documented and undocumented, but where we can actually begin to provide a living wage to workers that are now so essential to our very existence and the existence of the population at large. So I want us to also think of our students and how we can care for them in ways that are reflective of a heretofore unimaginable pandemic that comes along every 100 years or so. So we need to instill in them the possibility for self-making and understanding their own contributions and their own rights to live humanely and without the fear of the everyday as we begin to cycle through various waves of the pandemic. While we might have the executive tell us that perhaps we won't even have a second wave, we need to listen to science and how science is going to dictate our relationship to moving forward in ways that are meaningful. Because what use is it to actually open up economies where we're going to be so fearful of each other that we're going to go back to square one and not understand not only our vulnerabilities, but our possibilities for self-making and refashioning our relationship to the social. These are really key issues that begin with access to healthcare information, understanding legal barriers and how we might be able to surmount them, and how the question of income is going to be central to ensuring that we each have possibilities for protecting whatever is around us, and those petite freedoms that allow us to say, I can take care of my loved ones, and then I could go to work as a cashier, as a service worker, or what have you. Those are the challenges at hand, and I hope we continue to have conversations that are meaningful because it really affects the entire democratic commons. The issues at hand right now, COVID-19, really make us understand, and it gives us an opportunity how we can begin to think through social programming in ways that allow us to really rethink society in fundamental ways. And that's the challenge right now for us as educators. And I thank you, Anthony, and all of my colleagues, especially Roosevelt House, for giving us this opportunity. And I'd love an opportunity to learn from some of those who are actually listening right now to these presentations.
Professor Flores, did you want to make a couple of points before I turn it over to the Q&A session with the
Sure.
audience.
So I'm
Mhm.
just going to add 3 other things to what's already been said from my esteemed colleagues here. And the 3 that I'm going to add, the first one is telehealth to address mental health issues and well-being. And it's something that we've been depending on quite a bit because of the social isolation that people in these communities have been experiencing, right? And it's very important. We started off, you asked me about trauma, and we're talking about health, but mental health is critical. And there's a lot of stigma around mental health, even within the communities that we serve. So it's really important for them to understand that there are people out there that they can actually talk to and that they can have access to telehealth, and telehealth broadly defined, right? Because maybe they don't have the technology to do what we're doing, but we can also have somebody pick up a phone, right? And have the same conversation again, even on the phone. So that's the first aspect that I would say is something that we can do in the current moment and that people should have access to. And that will be part of those resources at the end. The other are resources for parents. And I think that's critical. Again, you know, right now, many people are wearing multiple hats, and some of them are our students, right? So not only are they the workers, but they're also the parents, and they're at home with their children and they're trying to homeschool. So think about that. From 9 to 2 in the afternoon, you're homeschooling, you're trying to work and doing that, and they require supports again as well, right? So I think going forward, those things need to happen. And again, I know that there are a lot of individuals out there who are actually doing that for families because it's critical. That also will reduce some of the stress, those risk factors. And then the last thing I'm going to say is community education. And I think that that's critical. And it's education around healthcare, but it's also just education around, I would argue, what's fact versus fiction. And how do I disaggregate that information around what's fact versus fiction for myself, my own well-being, my family members? Depending on what kind of news and information I'm getting, that also is going to affect my overall health and well-being, as well as my family. So providing communities with the resources to be able to do that, and then also letting them understand that there are resources in their own communities that they have and other resources for them. I think, again, CUNY serves as that function for a lot of people, right? But making that a stronger connection for the people that are in our communities, whichever borough we're in, so that they know that that's where they can go to get factual information based on the science, right? And not other types of information. So I'll stop.
Thank you. So I want to introduce some of the questions coming from the audience. One is dealing with the issue of the meat packing workers. So the question centers on the fact that these are usually highly skilled workers that we tend not to think about it that way. And so the person wants to know, how can we make their working conditions safer? And I'm sure this applies to other populations also. So what can we do as a society to better protect our workers?
That certainly is highly skilled work, but we need to keep in mind that depending on the state, upwards of 20 to 30% of these highly skilled workers in meatpacking industry jobs are undocumented. And when we have ICE raids going to those communities and arresting them and not faulting management for those hires, then we begin to see the discrepancy of what I called before, how Latinos become an exchangeable commodity under capital and under capital flows. So all of a sudden, when you have this presidential directive where he invokes the Defensive Production Act, and that Defensive Production Act ordered meatpacking plants to stay open no matter what cost, we as educators need to inculcate in our students and our communities and anyone who would listen what it means to understand that that cost is human life. These expendable commodities that happen to be human beings that have no other choice but to show up for work. So it is interesting to see the cracks in the national narrative about a meritocracy that allows access to so many, when the reality is that no one wants to do these jobs, and it is precisely undocumented immigrants who are engaging in some of the most difficult, challenging, and life-threatening work. And they do it for an idea, and that is the possibility of understanding their lives in relation to the metropole, the United States. And one of the things that we need to communicate to folks is that there is no significant immigration to the United States that wasn't occasioned by either military or capital campaign expansion. So when we think of, for example, immigration from Central America or from Mexico, we need to understand the US intervention in those territories and how those chickens come back to roost. And that reality becomes very difficult to parse out because we are a forgetful nation. And this is why our role as educators has to be central in communicating that reality so that then we can have an honest dialogue about a broken system, absent of scapegoats that are, the bread and circuses of the day. We need to move away from the demagoguery, and we need to move away to evidence-based historical facts and how it is that we absolutely need, much the way that we did in the 60s and early 70s, worker accords with our southern neighbor and even Central America, because that was central to getting the US economy going. So having those conversations are very difficult, but they're not impossible. They begin in the classroom, and they begin with the type of work that public institutions like CUNY are doing.
Anyone else want to jump in on that? Okay. There's another question from a student at CUNY, raising, again, the concern that was raised earlier, in that you have students who have lost jobs, sometimes family members facing financial precarity, but still have to persist this semester and continue. So the questioner wants to know, how can we better support students who are experiencing a mix of those factors I just mentioned?
I can jump in on that. I think it's a recognition that all of those factors are existing, right? And I think even for ourselves, we're all experiencing them at some level. And helping, so there's a factor that I didn't talk about today, which is resilience, right? And dealing with grief, but also trying to help and get through at the end of the day. And resilience is not innate, right? It is something that's learned. We had an onslaught of trauma, but again, at the end of the day, if we help people recognize that it's okay to grieve, by the way, right? It's okay to say that I'm experiencing this, and then helping them, right? And I think we can do that to figure out a plan on how they might get through. So even as a student, when we all have them right now who are going through this experience on a day-to-day basis, it's sort of a matter of taking a deep breath and saying, okay, well, maybe you can't do the top of the line that you might have thought you were going to do, but how can we help you get through given what it is that you have, right? And just allowing them to understand that it's okay. That it's okay. And I think it's giving permission for people to grieve and to understand that it is okay that you're not at your game, because most of us are not at our games. The physicians who are in the hospitals right now come home and they're drained from the hard day's work that they do. So I think that that's part of just letting the students understand that, and then helping them develop a plan to get through.
Anyone else? Yes.
I will add to what Professor Flores nicely explained, the fact that we cannot ignore COVID. It's the elephant in the room, right? So I think we are all dealing with having children with us and having, elderly parents to take care of. So, and this is very practical. I will say that rather than pretending COVID is outside of the classroom, invite the COVID situation into the classroom. Make it work for you. If you are teaching history, compare with the old-fashioned epidemics, not so old if we think about HIV. If you are teaching biology, talk about immunity and how viruses versus bacteria change through time. And also allow time for creating a new normal, a new virtual community. One of the problems that many colleagues have been raising is the fact that students may not be engaging with technology as much as they can. They are not there. Create situations in which students may access the video after the class is done, and use the classroom as an opportunity to heal. I love what Flores addressed in terms of resilience. We need to build a new way to become resilient with our students, with our colleagues. So if the classroom becomes part of the life, and we accept that, this elephant in the room is our elephant we have to deal with, I think it won't be such an intrusive situation to have a virtual learning, teaching situation vis-a-vis what we are all dealing with. And particularly students who do not have jobs right now, who cannot have a computer right now, and who have to take care of others. And last but not least, the issue of mental health. I completely agree with that. I'm from Argentina. Everybody has a shrink in Argentina. Now, finally, in the United States, people are talking about another elephant in the room, which is mental health. it's a stigma to have an issue. And on the other hand, if you look at the indicators right now, the mental health in this country, the indicators of depression and anxiety are in the roof. So we are finally, as a society, we're confronting another health disparity, because depression and anxiety are not new for communities of color. They have been always there. Structural racism is at the basis of this disparity. So as an opportunity, again, I think that we have this opportunity to embrace mental health as something that is affecting us all. Thank you.
Another question deals with the looming economic austerity. There's great concern that at both the federal, state, and local level, we are going to see draconian cuts. Right? How do we as scholars use our resources to try to protect these vulnerable communities? Anyone can jump in.
Maybe I'll just jump in.
Okay.
First, to just thank our panelists. Just so much to think about, and I think that what the steps that we need to take is documentation. So many of you have cited really important figures that we need to mobilize around, and then this kind of dialogue, I think, is important both strategically but also emotionally. I think to just have a chance to get together and talk about what's happening, and maybe most importantly is the action component. How do we take all this information and through this dialogue figure out what can we do? And income's been mentioned a couple of times, so I guess I would just throw out a reminder that our government just allocated another $500 billion, and I think there's a role for all of us to play in holding the government accountable and really watching where is that money going. Is it really going to address the inequalities that we're talking about, or is it just going to further entrench them? And it's like a unprecedented historic amount of funding, and I just think we ought to look at that.
And Anthony, I would ask, in adding to that, again, this goes back to education of our communities, right? To Jessica's point of holding people accountable. A lot of times people are very immersed in the current, right? We were just talking about this is COVID, so we're very stressed, we're focused on that, but this is going to end at some point, right? So again, educating the communities, and this is some of the things that we had been doing up in East Harlem, and they're continuing to do up in East Harlem, to be able to advocate for themselves, to be able to also talk to their own local officials, to hold them accountable, right? They are in their communities and say, hey, how is this affecting us? Like, you represent us. And I think that's very important going forward, even around the economy. And so not to lose sight of that, right? Lots of moving parts, but that is a huge part, to make sure that you're talking to your congressional representatives who do represent you. And actually a lot of them are available and they do want to hear this. They do want to hear this. So being present at the table, and then strengthening community members to step up and tell their stories and say why this is important to them and why they want that seat at the table so that they will be at the table. So I would add that in.
Yeah, I would also say that, and this is a response to Rocky Shin's question. I saw it on the chat, right? I think this is an opportunity for us to really push to advocate for better data sets, more data, more research, right, on communities of color. And this dovetails on Professor Juan Battle's question, I think, in the chat that I saw, but also to disaggregate socioeconomic status from race and ethnicity, right? I think that that's very important. But you can't do that, or how should I say this? You can only do that if you have high quality data. If you don't have the high quality data, it's just not gonna happen. I mean, that's the bottom line.
Absolutely. President Lima? Yeah.
And just to piggyback on that, I completely agree that we need high quality data, but we also need leadership that can translate that data in meaningful ways across national constituencies. Otherwise, those data sets, those possibilities for understanding science become mumbled in the constant Twitter sphere and feed of information. So we need to be very thoughtful too about why it is that we don't have Latinx public intellectuals that have the type of national representation and access to media circuits of power that our African American foremothers and forefathers do, because we need to learn from them. We need to learn how imbricating ourselves into the media sphere allows us then to reach broader constituencies and have broader audiences that could begin to understand not just community-specific concerns, but how those are tied to the broader democratic commons. So figuring that out is going to be central to getting that data, if you will, that science out in meaningful ways. Because all the science, if we're listening to the reports that are coming out of Washington during prime time all of a sudden, those scientific reports counter some of the things, if not the majority of the things that are coming from leadership. So we need to figure out then how to trust our own constituencies, and it's very difficult to do that in Latinx communities when we don't have a vox populi, where we don't have the type of Cornel West or Eric Michael Dyson that could reach communities in different ways. So we need to think through that and why that is so, and how to make our work as academics more meaningful in democratic commons by not just being beholden to the peer review standard, but how to communicate to our communities in the languages that are meaningful to them.
Thank you for that.
Absolutely.
That also leads into another question, and Professor Schramm mentioned this and a couple others. We have a president who does not believe in science, has uttered xenophobic, racist statements, who by all accounts was warned about this pandemic early, but chose not to act. How do we, again, as scholars, members of various communities, how do we, counter that? Because certainly there are many who rely on his every utterance, if you will. And we've seen some of the tragic results of that very recently. But again, what is our role here in amplifying our voices to counter the kind of xenophobia, racism, classism that we see coming from the White House? Anyone can jump in. Jessica?
Sure. I mean, I think the immediate effort has to be to try to counter disinformation. I mean, it really is a question of saving lives. When you see medical information or misinformation being trumpeted by the White House, and then people going out and literally losing their lives, that is some form of homicide in my view. But then obviously we have an election coming. That is our mechanism of accountability. And I think we need to make these election issues, and hopefully that will happen.
So I want to just jump in and say, because it was something that Dr. Lima mentioned before, and I know that I've talked about it, is taking the science and translating it for the communities that you want it to reach, right? We reach each other and we talk about what's important to us, but it is really the translation of science. And it doesn't matter whether you're talking about genomics or you're talking about poverty. That can be translated for the people for boots on the ground. It happens all of the time, but we need to make a bigger effort to do that. I think sometimes that's the harder part, right? It's uncomfortable to whittle that stuff down to maybe some talking points or bullet points, but it's critical, I think, now, because that's where the education of communities comes in, right? If they don't have this knowledge, then they are going to listen to that fake news, and they are going to, depending on what they're listening to, right? So I think it's really our responsibility, and I'm going to say it as that, right? It's to take that science and to translate that science into pieces that people can understand. Because it's not enough. Yes, it is in the peer review journals and it needs to be there because that's what's important for it to have its significance. But if it doesn't reach the public, then that's also part of the problem. And then again, at least for the American Psychological Association, we have a public interest directorate, right? That's one of the jobs that we have, which is to take that science and to translate it. We have an applied psychology side, which is to take that science and apply it. And I think that has to be part of the conversation. Not to say that those things are important. They are huge. We need to do our jobs as scientists, but we also need, and I think that's also part of the public good, right? Most of us get funding to do the work that we do, right? But it's public tax money that we're getting. So the public needs to benefit from what we do. If they're not benefiting from what we do, then that's part of the challenge. So I think it's our responsibility to do that.
Yeah, if I could just add on to what Dr. Flores said, I think, and what everyone has said, but they're all important points. I think it's important to have those community researcher partnerships to work together. Not that researchers sit in an ivory tower and think about, well, these are the important questions. And I'm sure they are important, right? I'm part of that conversation too. But to work with folks on the ground, working with the communities about, well, what are the research questions that you feel should be answered? What's really happening, right? To engage policymakers and practitioners, that's how you get policy informed and relevant research that then gets used.
I want to go to the closing section of our discussion. Right. So, we've had a very rich discussion here this afternoon, and to be sure, the COVID-19 pandemic is really a further reminder of the longstanding vulnerabilities of minoritized communities, right? Yet at the same time, as our panelists have said, the tragedy also creates an opportunity for us to stop this pattern. But in order to do so, we need to understand how and why, if you will, these communities remain disproportionately at risk. Then we must implement policies that make structural changes that substantially reduce this vulnerability, right? Part and parcel of that is marshaling the political will to create a society whereby when we say we're all in this together, we mean that race or ethnicity should not overdetermine the disparate impact of a crisis. So I want to thank the panelists for a very thought-provoking discussion. I want to thank, special big ups to Jessica Neuwirth, the Director of Human Rights Program here at Roosevelt House. I also want to thank the staff, Rami, Dan, for their technical assistance in making sure that this program came to fruition. And certainly last but not least, all of you who have tuned in, watched this, I hope this was good food for thought and that we can continue this conversation in another forum. Thank you again for spending your afternoon with us.